Welcome back, everyone. Summer is just about here, and many of you want to look your best and get rid of blemishes and wrinkles.
So laser skin resurfacing may be just for you. Dr. Roshni Ranjit Reeves is with Oculofacial Surgery and Cosmetic Center Institute, and she's here to tell us more about what she does. So welcome back to the show.
Thank you so much. Yeah. Excited to be here.
I know. Well, let's talk about laser skin resurfacing. What exactly is that?
Sure. So laser skin resurfacing is a cosmetic procedure that is used to address different changes on the skin. So patients who are looking for changes in their texture, pore size, blemishes, that's what laser skin resurfacing does. It uses beams of light to gently remove the skin layer by layer to promote new collagen formation.
Okay, so you kind of spoke about this a little bit, but can you talk more in detail about some of the main benefits of laser skin resurfacing compared to some other treatments?
Sure. So what laser skin resurfacing does, it allows for precision. We're able to know exactly how deep we're going, tailor treatments accordingly. Very versatile. We can use it on various skin types, tones, textures to address various issues. And it promotes collagen formation, and the results are really long-lasting.
Now, are there different types of laser skin resurfacing, and does it matter your skin type?
Yeah,
Right.
totally. So there's kind of two main categories. There's a non-ablative, which is more gentle. It doesn't actually touch the outer layer of the skin. It heats up the layers from underneath, and that's what promotes the collagen. And then the ablative lasers are a little bit more aggressive, meaning they do more for texture and wrinkles, but they do take off the top layer of the skin.
And who's a good candidate for this?
Yeah, so all of us are.
Yeah.
And with Mother's Day coming up, we should all treat ourselves. But it's great for all skin types, textures, tones. We have 4 different types of lasers: Moxie, BBL, erbium, CO2. And so depending on why patients are coming in, what they want to address, we're able to tailor our treatment to that. We have brides coming in, mother of the brides, patients who just want to do something before the summer, before vacation. And so really everyone's a good candidate in the right hands.
Okay, well, let's talk about results. I know we're looking at some, they look amazing there. So what are, some typical results, and then what's the downtime or the recovery time?
Sure. Great question. That usually kind of depends on what treatment you're getting. The patients that you're seeing right now, many of them have received Moxie BBL treatments. So it's 2 different lasers in one. We start off with numbing cream for about 20-30 minutes, so you don't feel a thing. Very comfortable procedure. We do the BBL usually first. That addresses more reds and browns on the skin, and then we switch the handpiece to Moxie, and that's more of your ablative handpiece. So that will help to retexturize the skin, makes your pores smaller. And then in addition to that, we have erbium and CO2, which a little bit different technologies, but we're able to kind of turn down the settings if they need a quicker healing time.
Okay. If there's someone who, they're coming in for the first time and they really don't know what they should ask for, can they call you? Can they come and sit down with you and talk through the options that might be best for them and their skin type and what they're looking for?
Yeah, definitely. I usually don't recommend doing anything on the first visit. I think it's important at the consult to just get to know each other, what the goals are, what skincare are you using. Have you had reactions before with certain products or lasers, or you need to do the whole thing? And then usually after that we'll come up with a plan, and then we'll proceed. But a Moxie BBL treatment is fantastic for patients who have never got lasers before, who don't have a ton of downtime, very predictable, and to date I have not had an unhappy laser patient.
And is this something you do recurringly? Like you do it every so often?
Yeah. Usually for less aggressive treatments like the Moxie BBL, I usually recommend doing it once a quarter. Some of the deeper treatments, depending on how deep we're going, we can tell patients sometimes it's a one and done thing, and sometimes it's not. But to be honest, most patients don't have 2-3 weeks to hide away anymore.
That's true.
Those days are kind of long gone. So that's why these treatments, we can do them quickly, efficiently, and even if you need more frequent treatments, patients are more excited about doing that than kind of hiding away for 2 weeks.
They'd rather come more often and just a slower process maybe than all at once.
Okay, perfect. What are we looking at right now? What are you
So that is the Moxie handpiece. And so it has little rollers on the and that go directly on the skin. And so the drier the skin is, and so you'll see my patients will say, I'm going to be applying some acetone to really dry the skin, the better the treatment. Because the chromophore of the Moxie is water, and your skin has to be super dry, so we're actually getting a nice even treatment.
Okay.
But it's really painless. I mean, these patients are so comfortable. The numbing cream is absolutely fantastic, and it wears off in about an hour after the procedure.
Yeah, I was going to say they do look very relaxed, right?
do.
They don't look like in any pain at all, so that's always a good thing.
Well, thank you so much for joining us. Was there something else you wanted to add?
I just, skincare is so important. Regular hydrofacials, facials, all that stuff to really keep these laser results lasting longer and longer, and we're able to help patients do that as well.
Perfect. Well, thank you so much for joining us. We appreciate it.
Yeah.
You can learn more and make an appointment by calling the number on your screen. It is 813-303-0123, or go to drrosh.com and spell out the word doctor when you do so.